Hi, I'm Dr. Obermeyer, and the purpose of this video is to review knee pain and knee disorders that are caused by a referred source of symptoms, often from the lumbar spine. If you have symptoms in your knee, especially in the lateral or outer portion of the knee, or in the back portion of your knee, that is sometimes particularly advanced and that is not linked with any specific traumatic insult or injury, it is important that you be evaluated for a possible referred pain source, specifically referred to as lumbar radiculopathy. Depending on which specific nerve root as a cause of the lumbar radiculopathy is involved, the area of the leg and the knee specifically can be predicted based on the level of nerve pinching. This phenomenon is referred to as a dermatome, and sometimes imaging of the lumbar spine helps to confirm which exact nerve root. Specifically, nerve roots S1 and L5 are commonly involved with lower leg symptoms, especially at the knee. If you've been diagnosed with relatively benign findings, for example, things like Baker's cysts or incidental cartilage or arthritis changes in your knee, but your symptoms are particularly advanced, it is important that this source of symptoms be screened for because further treatments and interventions for your knee may not help your symptoms. Screening for a lumbar spine source of knee pain is sometimes not straightforward because physical examination maneuvers, especially of the knee and leg, are not positive. However, there can be some subtle clues, including what's called the straight leg raise sign, where a tension is applied to the knee that affects the nerve that goes to the lumbar spine, which can reproduce symptoms at the leg and knee specifically. Findings at the knee that are suggestive of a lumbar spine source are relatively benign, where the physical examination of the knee can be either normal or somewhat incidental for changes that may not be linked with the source of pain symptoms. This is especially the case if you have a history of lumbar or back problems, especially that has been treated, and imaging confirms that there is disc problems or other issues that could be affecting the emanating lumbar nerve roots that innervate and provide sensory control over the knee. Pain that significantly waxes and wanes, that sometimes will be as severe as a 10 out of 10 type pain, or especially pain that radiates past the knee into the lower leg, calf, shin, or foot, or even at the thigh or hip or buttock area, is commonly caused by lumbar radiculopathy, specifically where the nerve roots affecting the leg are getting pinched at the lumbar spine. Conversely, symptoms that are related to an intrinsic knee disorder are commonly at the front or medial or inner portions of the knee, although there are always exceptions, and these symptoms are commonly provoked by activities such as standing, kneeling, climbing, squatting, or other loading activities where the area of disease structurally inside the knee joint is provoked or loaded as a result of patient activity. Sometimes response to treatment can be a critical diagnostic maneuver to help to really differentiate where the pain is sourced, and these come in the form of treatments, physical therapy, injections, and surgery. Injections can be one of the critical procedures that are performed in the outpatient office setting, where a local anesthetic, which is a numbing agent, as well as sometimes a corticosteroid, are injected to the area of suspected pain source. For example, if the symptoms are attributable to arthritis or, let's say, a Baker's cyst, and an injection into the knee joint does not alleviate symptoms, the source of the pain is more likely than not emanating from a referred source, commonly at the lumbar spine. Conversely, if you undergo an injection around the lumbar nerve roots, known as an epidural steroid injection, and this injection procedure alleviates the symptoms in your knee, the source of the pain is somewhat confirmed to be caused by the lumbar spine. The diagnostic dilemma with differentiating lumbar spine versus the knee as a cause of knee pain can be a conundrum because there are no perfect diagnostic tools. One of the more commonly discussed nerve studies, known as an EMG, can unfortunately sometimes be nonspecific as it relates to the knee pain itself. EMG is typically only positive in very severe cases of nerve involvement, especially when the nerve is so badly damaged that the motor function or the muscle control over the leg is affected. In other cases, patients can have sometimes quite severe pain symptoms and the EMG can still be normal. And that's why the finding of a normal EMG needs to be taken in context of other testing and clinical findings. If you have ongoing severe symptoms, especially that have not responded to knee treatments and interventions, and especially surgery, you should consult with an experienced diagnostician to help to understand the source of your symptoms so that you do not undergo additional procedures and interventions that are unlikely to help. Thank you for your interest in lumbar radiculopathy and knee pain that is caused by a referred pain source, and please visit our website for more information.